Uh, Hello everyone. I am Dr. Mohan Srisvastava, MD General Medicine, Arogya Medical Clinic, Visakhapatnam. Today we will be talking about the hypertension. What is hypertension exactly? Hypertension is the blood pressure which is above the normal. How the blood pressure is? What the blood pressure is? The blood pressure is when the heart pumps the blood into the blood vessels. The vessels create a pressure against which the blood has to flow into the vessel. This is called as a blood pressure. The hypertension is a normal day-to-day practice. In the normal day-to-day practice, we are encountering many hypertension. Hypertension is a very serious uh, disease if we ignore it. So basically, we have to know why the hypertension, why the BP occurs, why the hypertension increases. Mhm. Normally, there is a fluctuation in the BP in the general population, the healthy individual. In the day, as the day progresses, there will be fluctuations in the BP level. But in if the fluctuations are very much high, that leads to the hypertension. In the long run, it leads to a serious life-threatening conditions. The major causes of the hypertension are like having an unhealthy lifestyle or having smoking cigarette, obesity. These are some of the main causes of hypertension. The risk factors for the hypertension can be divided into some of these which are modified risk factors and non-modified risk factors. The modified risk factors, if we are able to modify those risk factors, we can cut down the usage of the medicine and we can cut down the BP to the normal range. The non-modified risk factors, whatever we do, we cannot change them. In the non-modified risk factors, the age is the main thing. The family history. These are the two main conditions which are not modified, non-modifiable. The modifiable were like avoiding alcohol, doing good physical activity, avoiding smoking, decreasing the consumption of the salt. Uh, these are the modifiable. Moving on, hypertension does not have any obvious signs and symptoms. That is why hypertension is called the silent killer. It puts the people at risk for the many diseases like the cardiovascular problems like heart attacks, kidney failures, brain stroke, and even the damage of the eyesight, and sometimes it leads to the blindness. Hence, if we diagnose the hypertension early, and if we manage them with correct medicine, there are many chances that we can avoid these diseases in the long run. The only way is to control the BP, and the only way is to know uh, to use the exact medicine to control the BP. Generally, when the symptoms do occur, they include having headaches, having blurring of the vision, extreme tiredness, and buzzing in the ear, fatigue, extreme fatigue, and nausea and vomiting. Sometimes the people tell that there is a headache in the hospital in the backside. Some people will come with complaints of blurring of the vision. Sometimes they cannot able to see objects properly. Um, Sometimes they will be having some disturbance in the ear. These are some of the symptoms of the hypertension. Sometimes there will be giddiness, as if everything is rotating, as if they are falling. These are some of the symptoms of the BP. Okay. Fortunately, the blood pressure can be diagnosed early and can be maintained in a normal readings. Okay. Your blood pressure is one of the easiest and the simplest diagnostic tool which can tell us so much about the current and the possible risks of the health. It is usually measured. The blood pressure is usually measured with the sphygmomanometer. Okay. The normal readings of the blood pressure are around 110 to 130, and the down one is around 80 to 90 mm of Hg. And the upper one indicates the systolic blood pressure, and the lower one indicates the diastolic blood pressure. If the blood pressure is crossing 140 by 90, 140 systolic and the 90 diastolic, then it indicates that you are having hypertension. Then indicates that we are going towards having a serious heart issues or any other problem. And we have to start the medicine when the BP is around 140 by 90. If the BP is falling between 130 to 140 and 80 to 90, we have to be careful. We have to cut down the intake of the salt. We have to consume good amount of liquids. We have to do regular exercises. We have to stop having alcohol, cigarettes, and all, so that we can control the blood pressure. The risk can be prevented by taking good steps. That is like regular exercise, what I have told you, healthy diet, quitting smoking, and even regular monitoring of the BP is also very much required. And strict management of strict management is very much required. Strict, strict adherence to the medicines is very much required. And also we have to manage the stress. Whatever the stress is, we must not keep it in our brain. We have to be stress free so that the BP will be under control. So if the blood pressure is successfully controlled, um, uh, we will be very healthy. So for that, uh, what are the strategies to be taken? Number one, regular physical exercise. The physical exercises, we have to do at least 20 minutes of physical exercises for at least a period of 5 days in a week. Okay. And the physical exercises per se, they decrease the blood pressure by around 10%. 10 to 15%, they decreases the blood pressure. Okay. The physical exercises can be brisk walking, jogging, swimming, or having cycling, bicycling. These are the physical activities which we have to do. These are the physical activities also help us in maintaining the weight. Okay, number two is healthy diet. Healthy diet is strict decrease in the salt, decrease in the consumption of the fatty foods, decrease in consumption of alcohol, increase in consumption of vegetables, increase in consumption of green leafy vegetables, increase in consumption of fruits, and increase in consumption of liquid. We have to consume good amount of liquid, and we have to contain. We have to stop having salt, consuming salt, high amount of salt, and we have to eat very less, eating less fatty foods. Okay, and we have to take the food which is rich in potassium. The food rich in potassium is fruits, especially banana, lemon. All kinds of fruits are having good amount of potassium. Actually, potassium decreases the blood pressure to some extent. The dash is the dietary. It is a dietary approach to stop hypertension. This is the dietary approach to stop the hypertension. It says dash says that we have to decrease the dairy fats and increase the green vegetables and green food, so that by having the by consuming the good amount of nutritious food, healthy diet, we can decrease the blood pressure by 11 mm of Hg, 11 mm of mercury. And the third one is decreasing the consumption of the salt. And the salt is mainly added as a preservative in the Indian diet. In consumption of the pickles, we pickles, what we preserve, they contain good amount of very amount of salt. So decreasing the consumption of salt indicates decreasing the consumption of pickles, what we use, decreasing in consumption of beverages, decreasing in consumption of junk food. Even the junk food, they have salt in a huge amount. So we have to decrease it. And before consuming, we can read the label, the food label, how much amount of salt is there. and we can have eat few processed foods. We have to decrease the processed food intake. And the third one is regular blood pressure monitoring is required to see. Self-monitoring helps to keep the BP uh, in, in the desired range. The self-monitoring, we can measure the BP in different times in a day over a longer period of time. So in over a longer period of time, we can check the BP and we can see whether the BP is coming under control or not. If it is increasing, we can go to the doctor. If it is in the normal range, we can continue the same medication. The regular monitoring of the BP and keeping the BP in the desirable range helps us prevention from major mortalities like from the heart or the brain and the kidney. Stress management, we have to maintain the stress by doing regular any yoga, meditation, listening to the relaxing music or exercise. The stress management is a key role in maintaining the BP. If if we are able to control the stress, we can control the BP. The both goes hand by hand. If one is increasing, the stress is increasing, definitely the BP will also increase. And furtherly, we have to consume many tablets for the BP and adherence to the adherence to the medicine. Actually, adherence to the medicine is very much required. If we are starting the medicine for the BP, we usually start the medicine if the BP is only 140 by 90. If it is crossing 140 by 90, we start the medicine. And the medicine what the doctor has prescribed, the patient must continue it. There is no point that the patient should stop it until and unless it is required or it is advised from the doctor. Keeping having the good adherence to the medicine will help you with will decrease the burden of the pill. If we are not able to control the blood pressure, if you are not able to take the medicine regularly, there are high chances that the number of the pills that you have to consume will increase. So adherence to the medicine is also very much important. So these are the ways where we can prevent or we can control the BP. Okay. At last, I would like to suggest that there is nothing more precious than our health. So for the good health, we have to we have to we have to do a healthy lifestyle. We have to build a healthy lifestyle. With the healthy lifestyle, we can control the blood pressure, even diabetes. We can control the diabetes also. All the controlling the blood pressure itself will uh, will prevent us from many of the cardiovascular problems, many of the neurovascular problems, from the renal problem, and if we can be more healthier. It is very much possible to maintain the blood pressure level within the normal levels by regular monitoring and taking of preventive care and by good medication.